Hi, my name is Atul Darush, professor and consultant of obstetrics and gynecology. In this short video, I'd like to show you the uterine modeling after laparoscopic myomectomy. And this can be seen in a patient who was PARO-1 plus 0, presented to me with secondary infertility 12 years and menorrhagia of 4 years. And on examination and ultrasonography, there was a big interstitial myoma, and she was subjected to laparoscopic myomectomy. As you can see, these are the steps of her operation before around 17 months. And you have to take care that preservation of the pseudocapsule was essential during the extraction of the myoma with meticulous hemostasis and microsurgical principles, with closure of the defect and not leaving any dead space using V-lock sutures. 7 months later, she got pregnant, and we followed up her until delivery at the end of the 9th month, and the scar was intact, and during pregnancy there was no pain in the scar or at the previous section scar. And this is the shape of uterine modeling after laparoscopic myomectomy. Here is the site of myomectomy and sutures. It looks normal like the rest of the myometrium, no defect, no dehiscence, and it sustained pregnancy until the end of 9th month. Also, you can observe no adhesions at all on the surface of the uterus after the cesarean section. So the keys to get a strong scar include preservation of pseudocapsule, which is an important issue for complete and proper healing of the scar, of a scrotum scar. Don't leave a dead space, and tight suturing is essential to avoid dead space and hematoma accumulation in the scar, particularly if you use V-lock sutures. In a previous study, we found that the postoperative sonographic diagnosis of wound hematoma may be used as an indicator of wound healing. That's usually complete within 3 months, and we recommended that myomectomy wound healing is usually complete within 3 months. And again, a review article mentioned something like this, radiological findings that uterine healing can be achieved after 3 months, and there is no proof so far to recommend minimal time interval between the myomectomy and conception. As you notice, no adhesions at all, and usually we do laparoscopy for post-myomectomy patients, and we find extensive adhesions. And in this case, no adhesions at all. And the keys to avoid adhesion formation include use of fine sutures and needles. Don't leave raw areas, invert the edges to inside to not to leave any edge outside to not to attract adhesions, with proper hemostasis and adhesion preventive sheets. So in conclusion of this short video, I would like to say that the message is to trust laparoscopic myomectomy scar and not advise patients for a long time of contraception after myomectomy, particularly if you make ultrasound follow-up of the scar and you find the hematoma disappeared and the site of the scar is normal. Sonographic monitoring is a reliable method of follow-up, and the number of and the strength of incisions would affect the decision of time to conception. If the patient has many incisions of the uterus, you have to expect that the uterine muscle is weakened more than if you use only one single incision. These are the short messages drained from this case, and thank you.